How do you have fillers and still look natural? When you look around, you see a lot of bad filler, but by definition, good filler should be invisible, so you never see it. So if we follow that logic through, it means that you only ever see bad filler. One of the most pivotal changes that happens in the face as we age is that we lose volume. We lose a bit of fat from below the skin, and this is a more recent realization. Some of the most significant volume changes happen at the level of the bone. It's actually quite depressing when you see the CT scan of the face of a young person and the face of an older person, because the bones literally are withering away below the surface of the skin. So when you have that combined effect of losing bone mass and losing the soft padding of the fat, everything begins to sink. And that's what normally results in most of the features that people associate with aging. The first thing that we need to do is step back and look at the big picture. If you are someone who is now into your mid-50s or getting towards 60, your face has probably been aging and losing volume for at least 2, possibly 3 decades at this stage. And so to truly restore that, it's going to take a reasonable amount of volume restoration. In general, filler lasts much longer than any of the pharmaceutical companies care to acknowledge. In my experience, although the products are licensed to last up to 2 years, I think they can last much longer than that. I've seen patients where filler has lasted 10 years. If the filler is hanging around that long, we need to be very careful about how much we keep adding, otherwise we get to that point where we've overdone it and we've crossed the line between good filler and bad filler. When you get filler for the first time, it is a really positive experience because you have been nervous about it, you've been apprehensive, you get it done, it looks fantastic, it makes you feel fantastic. The temptation then that you then have in your head is more filler is going to make me look better, it's going to make me feel better. And it can almost become a sort of psychological crutch that whenever you feel you need a little pick-me-up, a little bit more filler is the answer. Work from the outset to establish how much volume is going to be required, get us to that point, but when we get there we need to really take the foot off the gas and go much slower with the touch-ups. So what we normally do is see our patients back a couple of times a year for other types of skin treatments, and whilst they're here we just keep a little eye on the volume, and when we get to the point where we look and say, okay, the volume starting to decrease again, we add very conservative amounts. You need to find a doctor or a clinic that you trust to give you honest advice, so that if you come back and you ask for more filler, you need to trust their judgment that they're going to look at you and give you the correct advice. That is, actually the volume's okay right now, let's look at why you're feeling this way, rather than, yeah, you want more filler, let's whack it in. Because that's how you end up in the position where things look unnatural. Any questions or suggestions for future content, please pop them in the comment section, and don't forget to like and subscribe to our channel.